Thanks very much, Alistair. So I'm Gemma Chandratillake. I'm a trustee of Cambridge Rare Disease Network, but I'm talking today in my NHS role. What we've been trying to do is think about genetic test reports and how they could be better. So I've been working with a researcher, Gabriel Recchia, and he's going to talk about the results later on. And this is Menna, who is one of the participants in the study. She's a nurse in the Polyposis service, so she's one of the users of a genetic test report. So that's who we all are and how we're going to be talking. Okay. Just before we get started, since this is a rare disease conference, and 80% of rare diseases are caused by a genetic change in somebody's genes, we thought we'd just ask, have you seen a genetic test report before? You can use the Glyssa platform, I believe, to answer the question. I think they'll probably leave the poll open for a couple of minutes or for a few more seconds. There we go. Okay, so there we go. And it's going to move a little around between 30 and 40%. So quite a few people have seen genetic test reports, but not everybody by any means. Okay, let's close that poll and move on. All right, so the idea is that if we want if people are having genetic tests, we want those genetic tests to be actionable. We want them to deliver benefit for patients. So we want clinicians to understand what the genetic test report says, and we want patients to understand what it means as well, because genetics is a family affair. So we want people of different backgrounds and different levels of health literacy to know what they should do once this genetic test result comes through. So we need to present genetic test results to the ordering clinicians and patients in a way that they can be understood. So how useful would you think a genetic report would be to you as a patient? Or do you just think it's something for your doctor? Do you think you'd get anything out of seeing one, since only about 30%, 40% of people have? I don't know what the score is. It's 5 minutes. That must be very useful, is that?
I presume so.
Let's presume that the purple bar there, which I don't have the key to the information, is very useful. So that means that people would like this information and they'd like to understand it, hopefully, right? Okay, let's move along. So in the UK, we only have about 200 clinical geneticists and about 300 genetic counsellors. So we're doing more and more genetic testing because the technology has got cheaper and there's a great need for people to get diagnosis through genetic testing. But the tests are increasingly being ordered by non-specialist clinicians, and this concept is known as one of mainstreaming. So we are basically democratizing genetics, letting more people have genetic testing. But that means that non-specialist clinicians are increasingly ordering tests, including primary care clinicians. And we know that these clinicians have difficulty in understanding the reports. So we know this from the literature. We also know it from our own information in the NHS when we hear from different clinicians and they say, I don't know what that means. So this is really an opportunity. My role in the NHS is to train people in genetics and genomics, so I'm trying to train healthcare professionals in genetics and genomics. So I think of the report as being my contact with that healthcare professional. And so I can see this as a scalable educational tool because adults actually learn when they need to. So people learn things just in time. So you've got a patient coming in, that's when you're suddenly going to learn about genetics, that's when you're going to be motivated to learn about it. So there's an opportunity there to teach people by using the reports. And also this will help with patient engagement and empowerment if people actually understand the reports as well, and that will help with cascade testing, so testing of other family members to be able to provide preventative care. So what we decided to do is to try and take a user-centered design approach to genetic testing reporting. So what we do is we work with the users, so the non-specialist clinicians and also patients and families, people who've got rare disease experience and people from the public. And the idea is that we work with them in an iterative process because we're trying to maximize the likelihood that the end product that we produce is fit for its purpose and easy for its intended audiences to understand. So first of all, we looked at developing a general template for genetic test reports. And we did this through a series of interviews and online surveys. And then we decided we should test it. So we took one particular condition as our test case, and we used cystic fibrosis carrier screening. And the reason we chose this test case is because this is in the east of England, which is where we are, this has been mainstream to primary care. So GPs are ordering this test, so we felt it was an important place to start in making reports clearer. So the question we were asking is, are these new reports that we've designed more effective at communicating information than the current genetic test reports that are being used in the NHS? So these are the kind of features that we came up with on the report template. We worked a lot on the formatting of the report, and we wanted to make it, to contextualize the test and explain what it was for. We framed the result as a fact, not as a positive or a negative result, just a complete statement of, a straightforward statement of fact. We talk about the risks and giving absolute risks, and using the same denominator in what we were doing. And what we found by engaging with the patient communities were that there were three things that were really important. What this result means for me, next steps, what should I do with this information, and where can I go to get more information and support? And social support from others with the same condition was very important. I don't think anybody in this room probably needs me to tell you that, but that isn't something that's currently provided through genetic test reports. So we thought that was an opportunity to rectify that. The very technical information which is required by geneticists and laboratory staff could be mentioned later in the report. Patients and the public and healthcare professionals thought this was important information to include, but they didn't see it as the take-home message, so they felt it could be sort of deprioritized in the ordering. But by including it as well in one report, you are meeting the needs of the specialist and the non-specialist users as well. So this is one slide to actually just summarize an awful lot of work that was done in terms of interviewing through three rounds of interviews, about 30 people, showing the kinds of things that we would do. So we would try how to explain a genetic variant. A variant is a word that we use in the genetics community, but I don't think it means a lot in the general public. So we tried to use the word gene change rather than genetic variant, but we found that people understood gene alteration better. So by doing this kind of work in a very iterative way, we were able to get clearer understanding. So then we came on to test the reports, and here I'm going to hand over to Gabe.
Sure, thanks. So through this work with patients and members of the public and healthcare providers, we felt that we would probably iron out some of the most critical issues, but we wanted to really subject these reports to a more rigorous sort of evaluation. So we conducted a study where we had 193 people participate, and so there were basically, you only saw one particular report if you were participating in this study, and there were 4 possible reports you might see. So 2 of those would be the user-centered design reports that we designed, one of which was a positive result, one of which was negative, and likewise, then half of participants viewed a de-identified standard report from a UK clinical lab. Again, you might see either a positive or a negative report. And they were given a scenario where you imagine that this report is given to someone who has gone through carrier testing for cystic fibrosis, and their partner is a carrier, and it's giving them information about their own carrier or status. So you can kind of see here is the difference in what these reports look like if you look at just the first page here. And the key things we measured and explored, we were interested in subjective comprehension, so how well did people feel they understood the information in that first page of the report. We looked at objective comprehension, so really focusing on the risk to the first child and how people understood their carrier status, had 7 comprehension questions associated with that. Communication efficacy, this was an existing scale from the literature that just looked at a number of different things related to, is the report effectively communicating the sorts of things that genetic reports are supposed to communicate? So does it communicate the result, the implications of that result, information resources for the patient, and so forth. We also looked at clarity, trust. Again, these are all sort of just subjectively asking people about their experience and having them rate this on a scale. And we also looked at sort of actionability questions. So how clear are people about the next steps that they could take? Do they feel that they would have the necessary information to decide what to do next, and so forth? So that was sort of went into an actionability scale. Overall, so here you can see these density plots. So the blue is thick line is our user-centered reports, and sort of farther to the right, if the peak is there, that is higher. So we found really huge effects as far as communication efficacy, as far as clarity. What was really important to us is this actionability. People said that they understood what to do next better. They reported that it was easier to understand the result, and reported better subjective comprehension overall. No difference either way in terms of the objective comprehension questions. So remember, we had given those 7 questions, some of which were fairly straightforward, some of which were a bit difficult. You know, imagine 1,000 people who were in this situation and received this report. How many of those children could be expected to have cystic fibrosis? So we actually felt it was encouraging to see that both the user-centered reports and the control reports, people seem to understand this for the most part, although I think there's more work that could be done. So at this point, I think we wanted to bring up Menna, who participated in the study, and if I could ask you a few questions about your experience in the study.
Yep.
So first of all, what do you do? What's your day job?
So my name's Menna. I'm a polyposis nurse specialist. I work in the Polyposis registry at St Mark's Hospital, and we look after patients with a genetic condition which predisposes to bowel cancer. So genetic testing and genetic counselling is what I do, and we try to encourage cascade testing, but we also then provide a clinical management for our patients. So from endoscopic screening to prophylactic surgery, and we do sort of lifelong based care with our patients and their families.
And could you briefly say sort of what drew you to participate in the result or in the study, and what was your experience like?
So I think it's really, really important for us to be able to understand what we're telling our patients. We feel like we're the in-between from the labs to the patients. And as someone with a nursing background rather than a genetics background, the earlier slide showed what a genetic report looks to us at the moment, and it's difficult to understand. The language used is not what we're used to, and especially with mainstreaming coming in, more and more clinicians like myself will be doing genetic-based sort of information work with our patients, and sort of, you know, it's bridging that gap between the clinical care that we're giving at the moment.
Yeah, and can you say a little bit about what you actually then do with the report when it comes in? So do you give it to a patient, or under what circumstances do you do that versus, or what else would you use it for specifically?
So really sort of patient kind of journey genetics wise, we do the counselling. It can take up to 6 months to get the report back. And then we look at the report and we interpret that report, and we're able to then give that information to the patient. Now, in terms of the report that you created looks at kind of the next steps, which is what we do with the patient at the moment. There's nothing on that report that we can kind of give to the patient as a tangible, understandable thing for them. And I think it's really important for the patient to be involved in their care and in the genetic element of their care as well.
Yeah, so if reports did start to look a little bit more like the ones that we've designed, do you feel that that would give you something that might be of benefit to share directly with the patient, or are there things that would need to change for that to happen? And
No, I think we strive to be as patient-centered as possible. We like to involve our patients in every part of the journey with them, from diagnosis to the cascade testing to surgery. So I think having something like this that they can understand as well, there's different levels of understanding and education, for example, with obviously the whole general population. So we need to make sure that we are giving clear information to our patients, and as well, not just for themselves, but in order to start those difficult conversations with family members about what their condition means and what it means to the family members. And as well, our patients are looked after all over the country, so to have something like this to actually give to other health professionals who will look after them potentially locally is really, really helpful, because at the moment, I mean, polyposis is one of the rare conditions, and I'm sure patients in the audience understand. When you go locally, you might find a health professional that doesn't understand what your condition is. So I think having a clear report will be really, really beneficial.
Should we
Okay.
close with the last question?
Yeah, so I think we just wanted to end the session with one more question to the audience response system. And we just wanted to ask, what would you want, as patients who have rare disease and therefore have genetic testing, what would you want from your genetic report? To know if I have a condition, comparisons with other families, easy to understand information about what the results mean for me and my family, clarity regarding the implications, clarity for non-scientific professionals, such as admin teams who deal with data entry and handling, clear indication of what it will mean to me, what I can do about it, where I can get more information, answers, clear information, what the specific changes mean, layman's language and a good layout. What does the result mean for me medically? If I want children some days, what do I need to do now? Do other members of my family need to be tested? Where can I find a support group? As a patient, information on what to do next, where to go to find information on treatment, support, therapy. And this is what we found during the study, and this is what we've tried to make the report template that we've designed address some of these needs.
I think all of those type of things are what we do as clinicians, but actually to have it on a report that patients can take away with them and start to understand it in their own time is just, that's exactly what we would want.
So we should do a quick plug. We are still running the study, and we are recruiting participants. So if you're interested in being involved in a study like this, please catch up with Gabe. We've got some, if you go to the NHS stand right along at the end, we've got some flyers there.
That's right, and I should add this particular study is kind of a follow-up. So this work is published, but then there's another one where we're focusing on.
That's true. Sorry, the paper just came out for this work last week. So this is about cystic fibrosis carrier screening, and the study that's going on now is on BRCA.
Yeah, that's right.
So that's the hereditary breast and ovarian cancer syndrome. So if you're interested in just generally being involved and participating and helping to try and make these reports better, Gabe's going to do that work. My job is to try and get it actually into the NHS laboratory. So wish me luck. And thank you so much also for Cambridge Rare Disease Network, who helped us recruit participants into the study last year at the conference, last year or 2 years ago at the conference. So some people actually participated in a study that's already been published. Thank you.
Great. Well, thank you very much. Thanks to some really excellently disciplined presentations. We have a couple of minutes for questions or comments from the audience. So, how do we get the patient support group included in the more information section?
Yes, so what we did with the cystic fibrosis one is we put the cystic fibrosis patient support group on there. So I think,
Yeah, but you should really get in touch with us because part of what we're trying to do going forward here is not just to make reports for one condition at a time, but to essentially demonstrate this is the process by which these more easy to understand reports can be developed, and this is the process which will need to include a process for finding appropriate support groups and getting in touch. So I think people have contact information.
Yes, contact information for us.
Feel free to contact us directly.
Is there any formal teaching that clinicians can attend regarding genetic reports? Yes, there is. Lots of formal teaching that's going on at the moment. For the last few years, Health Education in England has been funding healthcare professionals, such as Menna, to undertake training in genetics and genomics. And so several universities around the country are running those programs. They're called genomic medicine programs. And if you want to know more about the education that's available for clinicians, there's lots of online courses and things. I have a ton of leaflets on the stand, the NHS stand that you'll see. So get in touch with me if you want training in genetics and genomics as a healthcare professional.
I should just mention, with respect to that first question there about the best way to communicate.
Variant of uncertain significance.
Exactly.
So the technical term for mutation of unknown clinical significance that the community has settled on these days is a variant of unknown significance. And
that's exactly one of the things that we're trying to find out through the BRCA study here that we're doing now. So if you have thoughts about that, please
we're not going to say the best way to do it. What we're trying to do is find out the best way to do it and to actually test that information as well. We want suggestions, and then we can test them. Biggest surprise.
I'll just say quickly, one of the biggest surprises was, so people said they wanted the result to be really nice and clear. So in one of the versions that we tested, we thought, okay, a nice way to make it clear is to put it in a big clear box. And that actually made it easier for people to miss when we did the large-scale testing, because I guess something like a box, it sort of looks like a advert or a heading, it kind of blends in. So this just really underscored the importance of actually doing this testing, because if we were just kind of using our intuition, then we would have gone with the box, and that would not have been the ideal thing to do. So really underscored for us that this testing is worth.
With the inclusion of information about support groups, I mean, obviously this is an official NHS communication if it gets adopted. Do support groups have to go through any form of validation, accreditation before you can put their contact details on your report?
I think this is really, really early days, and we have to sort of figure this out. So we do put lots of links to NHS information. That's our first place that we would go to put it. We'd find the NHS choices and things for people. When with respect to the support groups, I think that's something that we need to have a wider conversation about. But it's a very strong ask from the user base, and people are going to go onto Google anyway. So I kind of feel like finding good patient support information and putting it there in the report is a helpful thing to do, rather than just leaving people to go onto Google and try and find something. So I think it's definitely something that we have to think about how to actually do that. But it's definitely a real ask.
Great. Okay, fine. Well, thank you very much to the three of you, and you're all around to the end of the day. So if there are more questions or comments, please get hold of them, and Ben, there it is. That's good.
Thank you.
Thank you.